Right, well, thank you very much for today. It's another day. And my name is still me and Omar bin Abdullah, Wosu Kabi, MC Online TV. As we give you tips concerning health issue, today will be World International Day for Malaria. So we are lucky to have a doctor from CCTH. When we talk about CCTH, Cape Coast Teaching Hospital, and she is Dr. Ama Owusuwa Kwachi. She's going to help us to deliberate, explain, educate the public concerning malaria. When we talk about malaria, there are many symptoms. Whether the doctor can maybe prove whether it's part of the 6 killer disease. As time goes on, we'll give you a little statistic concerning how malaria is killing innocent people and who are at risk. Doc, good morning.
Good morning.
And we thank you very much for receiving our call as well as maybe coming to our studio.
Come.
All right. Doctor, today is World Malaria Day. So when we talk about malaria, before we go that, since when did you start working with the teaching hospital?
You mean Cape Coast Teaching
yes,
Hospital?
Yeah.
That was last year.
Last year?
Yeah, last year, June.
Okay. So how do you see the hospital? The facilities we have and the leadership as well?
Everything is okay.
Sure?
Yeah, everything is okay.
What about the nurses you are working with?
The nurses I've been working with, everything is okay. They are okay.
We have relationship and effective communication because patients always complain about that. How the nurses, the guests and pushers of them, always they complain. How do you see it?
For Cape Coast Teaching Hospital,
yes,
for me, I've not had an encounter where a patient comes to me and reports that a nurse has gotten maybe a very bad treatment from a nurse, or they have communicated to the nurse very poorly. I have not gotten that report before, so for now, that is what I will say, that everything, there's a cordial relationship between us and the nurses, and also the patients are also receiving their treatment from the nurses very well, and there's no rift between the nurses and the patients.
Do the patients often report issues to the doctors or all the way to the nurses?
It depends on the type of issue. If you can probe further, which issues do you want to know about? If, let's say, there's a complaint that the patient is having about the health, the patient will report to the doctor. Or if the doctor is not around, the patient will let the nurse be aware, and the nurse will try and get to the doctor so that the doctor will see the patient.
Yeah, well, thank you very much. Before we move ahead, WHO World Health Organization has put figures out there. That's 2022. Their figure says 249 million cases of malaria reported in 2022, compared to 244 million cases in 2021. That shows that always people get malaria most in the world. They add up that almost 608 deaths occurred in 2022, as at compared to 2021, 610,000 deaths occur in 2021. So as we are moving forward, we'll see whether last year, 2023, what deaths occurred concerning malaria. Doc, when you talk about malaria, when somebody asks, what's the meaning of malaria, what would you explain to the person?
Okay, so I'm sure everybody listening to us knows about malaria. Once you are in Africa or in the temperate zone, you've heard about malaria. Malaria is just a disease that distorts your body physiology. So it's when we get this disease from mosquito, a mosquito that we know called Anopheles mosquito. We have some other types of mosquito but those types gives different types of diseases. But for the purpose of our discussion today, we will just dwell on Anopheles mosquito. So malaria is just a disease we get when it can be mild, life-threatening when we are being bitten by Anopheles mosquito and they introduce the parasite into us. And the parasites, the most common culprit is the Plasmodium falciparum.
Doc, we have 6 killer disease. Malaria also part of the 6 killer disease?
So the 6 killer disease, mostly we talk for the pediatric population.
Yeah.
Still, from what WHO is reporting, malaria is still part. Because if they are saying under 5 mortality, about 80% of them are dying from malaria.
You talk about Anopheles mosquito who cause malaria always.
Yeah.
So it's only the Anopheles mosquitoes or all mosquitoes can also cause the malaria?
So that's what I was saying, that we have other types of mosquitoes.
Okay.
But the ones that are culprits for malaria is the Anopheles mosquito. The Culex and the Aedes cause other kinds of diseases. And there are some people always say, there are some literature that backs that Aedes can also cause malaria. But that one, it's not a strong backing. We just know of Anopheles mosquito that causes malaria.
So without Anopheles mosquito, you cannot get in touch with this malaria issue?
Exactly. So it's the main culprit here is the mosquito. So everything, so from the life cycle, it starts from the mosquito bite.
What signs and symptoms it will occur when you see that you are getting malaria? What signs and symptoms, type of signs and symptoms?
Okay, so there are a variety of signs and symptoms, and some of them are not peculiar to only malaria. So you realize that the person will just complain of headache. The person will complain of having warm body temperature, that's fever. Some of them will come, they'll be vomiting. Some cannot even be eating. Some will have a very low sugar. Some will come and you realize that the quantity of blood that they have is very low. That's what you call the anemia. Some will come with yellowish discoloration of their sclera. Some seizures. The seizure can be from the malaria itself that has affected your brain, or your temperature is too high so that one can also call a seizure for you. There are variety. That's why initially I said it can be mild or very life-threatening. Some people even come very weak, having some issues, jaundice. Their urine color will now be, the term is Coca-Cola. So there are a variety of symptoms, signs and symptoms, and you realize that there are other disease conditions that will present with these same signs and symptoms also.
Always when you hear about doctors or health personnel are talking about malaria, you hear about the parasite. So okay. There's a difference between the Anopheles mosquito or when you talk about parasite, it means what? Okay,
so let's go through how we get into contact with the parasite. Yeah. So it all starts, as I initially mentioned, it all starts from you being bitten by the mosquito. Now the mosquito, in the quest of the mosquito biting you and getting food that is sucking your blood, ends up leaving its saliva in your blood. And that saliva contains the parasite. And that is what I mentioned as the culprit. The common culprit that we know is the Plasmodium falciparum. That's the parasite. We have other Plasmodium ovale, we have the Plasmodium vivax, we have the Plasmodium malariae. But the most common one that we mostly isolate in let me say Africa, narrowed down to where we are, Ghana, is the Plasmodium falciparum. So that's the parasite. So the vector that is carrying the parasite is your Anopheles mosquito. And in the quest of the Anopheles mosquito, getting some food to eat by biting you, leaves its saliva, which contains the parasite. That's the Plasmodium falciparum. It goes through your body. There are a lot of processes going on, pass through your liver, starts breaking down, making a lot of schistocyte merozoites, then they release into the body, into the blood. So you realize that if you have realized how the malaria, I don't know whether, I'm sure everybody has gotten malaria before, how the fever starts, it comes, subsides, and comes again. So the releasing of the merozoites in your bloodstream synchronize with those exacerbation of your fever symptoms. So the thing starts from the bite, leaving the saliva, which contains the parasite. The parasite goes through a lot of processes in your body, dividing itself, releasing into the, so we have the liver stage and the blood stage. So when it gets to the liver, it replicates itself. Some are just kept there in the latent phase. Some goes into the blood, replicates itself, and they are released into your bloodstream.
Look, let's see this. Somebody will get a fever, somebody will get a headache, somebody will get a diarrhea. Can all this maybe put them together? Can we say it's malaria because of getting on this or different?
So I would say malaria can do that. That is why I initially said that the signs and symptoms of malaria can also be seen in other conditions. So when we come to so we call them possible causes of your presentation. So when you come with the fever, the diarrhea, and you mention another symptom.
Headache.
Headache and the fever.
Yeah.
There are other things that can cause headache, fever.
And we have many?
The most closest one is typhoid fever.
Typhoid fever.
Yes, the most closest part is typhoid fever. But because you are talking about malaria, I just didn't want to mention the other one so that we focus on. So that is why we always educate the public that when you think you know malaria, you know malaria. So when you get these symptoms, don't be in a hurry to go and do your self-medication. Come to the hospital and let's test.
Come to the hospital. Others also complain about abdominal pain. Are the same as that?
The whole is the same as that. Some people get abdominal pain. Some people, even in the kids, it's just funny. The kids, kids cannot actually tell you they are having headache. I know my colleagues in the pediatric population, everything about them, even if it is their ears, they will tell you they have stomach pain. Even if it's their head that is aching, they will tell you they have stomach pain. So for the pediatric population, it's very common.
Yesterday, I get in touch with a patient, and she made mention of when she started feeling that she would get malaria. She would talk about the headache pain, vomiting, discomfort, diarrhea, abdominal pain, joint pain, and rapid breathing, and so many cough as well. So when she started seeing all these things, that's why she had malaria. But I challenge her.
No, you can't, because from what you just, someone having cough, difficulty in breathing, fever, can be another disease. Do you get it?
Yeah.
So their constellation, the science, and your body is just like a machine, like a car that you are using. When there's a small fault, you realize that the state of the car changes. So the small fault too can be from any other part. But you realize that at a point the car cannot function as how it was functioning initially. So this is what you have to do. When you get all these signs and symptoms, you come to the hospital, you be attended to. Then investigations will be conducted. For all you know, it is not malaria that the patient you got in contact with had. Probably is another one. But I think in this our part of our world, we always say that, oh, I know I'm getting malaria, so let me just go and buy the malaria drug. I'm sure that is what the person is doing, which is wrong. We are not supposed to do that. You get the signs and symptoms. You think you have malaria, fine. I don't doubt you. But come to the hospital, then we examine you, check you, run some labs, and confirm the parasites in your blood before we can treat you. Probably by the time you realize it is not malaria.
Seeing the doctor, as the doctor is saying, he or she is supposed to see the doctor. We'll come to her again concern a history when I came to the hospital. When did I get pain or cough or whatever? So is history very important when you go to hospital? You are watching MC Online, Wosu Kebi program on health issue. Today is World Malaria Day, and we are lucky to have Dr. Amma Owusuwa Kwashi. She is here helping us to educate the people concerning malaria. That can people will say ATD, Dr. Gudo Tumamba. Me kwa kwa hede obi here the office to be moko ya pomzana so ya abakwasam ohia. Sana yarban dabane no shasi. Ibu ma by 3 days. No kacho under the Namuhonda and an answer mode. Dr. Bison no unmade also moon because Abia no sure there or unmade doctor and Abia Bacas name and no bed. Oh, here, there would Moko Mutum and Mabakwasam and Name history. Mutum Macan Papa, I'm doctors who will be able to dash as a drama or to mobile or a doctor Menzie, Nina, the Menzaman or Tumu here, Abra Marco or your apples because she is saying that you're supposed to self-medication is not good, but you should visit the hospital as well. What history is very important. Doc, we are coming back again. As I'm saying, history is very important in terms of when you attend the hospital or not.
It is very important. In fact, history, let me say, is the key thing. That is what we use at the hospital. Because if you come and you are having headache, and you don't tell me you are having headache, you are having, let's say, abdominal pain, that is where my concentration will go. So the information that you give me, it's like the computer. Information that you give, that is what it will process for you. So it's the information that you give that will help the doctor to help you. So you come to the hospital, we ask you, what are your symptoms? You give it to us. We want to know when it started, what you've done about it. There are some people, they will self-medicate. But when they come to the hospital, then they come and tell us that, oh, we have not taken any malaria drug. We are asking you because the malaria test, there are 2 tests that we can do. We have the rapid one and we have the microscopy one. If you have taken malaria drug, there's no need for us to do the rapid one. Because the rapid one, once you take a malaria drug, whether you have it or not, it will show positive. You get it? Yeah. And now we will channel ourselves to another form of testing. But if you give us this, that, oh, you've not taken any malaria drug, I have written it, I know that, oh, this my patient has not taken a malaria drug, so the results that I'm getting is a true reflection of what is happening in the person's body. Meanwhile, you don't have malaria, but you have already started taking anti-malaria. Then I go and do that test and it's positive. Then I treat you with this malaria, meaning you didn't help me and you didn't help yourself.
Sometimes you attend to the hospital and you realize that the doctors want to do several tests, typhoid tests, malaria tests, and many more. And this COVID issue also bring a lot of tests all over. And some tests you cannot get it immediately after they send it to the lab. They will say, go tomorrow or 3 days time you should come. Why all these things? Because I said this is what is worrying me, but so many tests. Why? No.
So depending on the presentation that you come with. So let's say someone, you have come with your signs and your symptoms. Remember I said initially, so for one, when someone has malaria, fine. You come, maybe headache, vomiting, everything. You request for a malaria test. But the other conditions that can also present in the same way that you are talking about, that the person just said, oh, when I get this, I'm having malaria. Meanwhile, that is not what is happening. Probably you will come and it is malaria and it's so severe that it has started causing some complication. You remember, someone can come very weak, cannot eat. So you will need to check your blood sugar. Malaria itself can cause decrease in your blood glucose level. Malaria, when you start breaking down your red blood cells, getting anemia, your urine becomes cola-like. That cola-like contains a pigment. When it gets to your kidney, it can shut down your kidney. So when we see that you are having that breaking down of red blood cells, we need to check your renal function test so that we sort it out earlier. Because if we don't sort this kidney injury earlier, it might turn into a chronic injury. So when you come and you are saying that, oh, go and do this test, go and do that test, it's not like we just want you to go and do the test. And it's not you, if you've realized there are countless times that maybe they have diagnosed you with malaria, but it's not every day that you do all the tests that you are mentioning about. So it depends on what you are presenting with.
Especially females, when I turn to hospital, I feel some cold, I feel some pain, I feel some headache. They will add that pregnant test. Why, Doc?
Good. So pregnancy also has that symptoms. Vomiting, early morning vomiting, headache, chills. Pregnancy also will get you into that category. Especially then they ask you when was the last time you got your menses, and maybe it has delayed for some time. They will do a pregnancy test. So there are certain things, and even the pregnancy, sometimes if you are pregnant and you are having malaria, depending on the stage that you are in, helps us the type of treatment we should give you. There are some drugs that we don't give to pregnant women in the first trimester, and there are some drugs that we don't give. So if the person is in the first trimester and having malaria, at least you know the person is pregnant. Then it will inform you what to do.
Inform you what to do. That's what the doctor is saying. So far as we have added up the history, the type of medicine you're supposed to, always your health people also as educators also, if you can buy at the pharmacy and check whether you have malaria or not. Didn't this also help people not to attend to the hospital? Because she or he may think it, when I check I have malaria, I have a medicine in which I can buy it. You go to pharmacy, they will give you, when you said you have malaria, they will give you whether malaria tablet or whatever. Didn't it also draw people that they don't want to attend to the hospital, doc?
Sure. So when we say visit the pharmacy, we have some pharmaceutical places, those have pharmacists, and those people conduct the test for you. When we say go to the pharmacy, it's not every pharmacy. So there are places you go, there's no pharmacist. You are not assured of what the person is doing. So if you get a very good pharmacist who can test for you there, fine, the person will test for you. And there are some, the pharmacists, they will test. After that, if they need to send you to the hospital, then they bring you to the hospital. They tell you to come to the hospital.
Look, let's see also this, always the doctor's handwriting in terms of writing medicine to people, it's a different thing altogether. You will never ever read a doctor's handwriting in terms of prescribing a medication for you. Why did you learn all these things in terms of prescribing? Because you don't want anybody to see that you are writing. Even Pala,
no, please.
A doctor will write, you will never see unless you go to the pharmacy. When they give you the medicine, you see the Pala.
No,
Why?
Please, no, please.
You want to hide something?
No, we don't want to hide something. Probably maybe they are in a hurry. And because they are in a hurry,
so you are in a hurry, that's why you write that.
But now in our system, I think that thing is being fading away. Because we are now using the system. Like everything is on the computer. We are using the limbs. I think that thing is fading away from that. And even sometimes, back then, if the pharmacy also cannot see, they call back to get to it. But it's not like we have learned how to write in that manner. I don't write that way.
Are you sure?
A lot, and I've seen a lot of my colleagues who doesn't write that way.
Oh, I see. Then I'll come and check myself because there are many handwriting in which you cannot see because I have testified for it maybe 2 years back. I go to hospital then I realized there is Palas. And I can't read. Look, let's go ahead. Who and who is at risk?
Okay.
In terms of when you talk about malaria.
Malaria. Okay. Let me start. First and foremost, we all at the temperate area, we are all at risk of getting malaria.
Okay.
We are all at risk because the mosquito is actually here. So we are all at risk. So whether you are an adult, whether you are a child, male, female, whatever your status in the community, we all can get malaria. Whether you are the doctor, whether you are a patient, everybody can get malaria. But there are some people who are actually more susceptible than others. So we call them those who are immunocompromised or those whose immune system is very low, especially the children. And when I go to the children, I'll go down to the under 5 people, those who are under 5 years. Then those who are pregnant, they are also more susceptible. And those who live close to the slum, they are more susceptible. Okay, so you realize that you go to a low socioeconomic area, they live in the slum, they leave their bushes around. Realize that you'll be recording a lot of mosquito, like malaria at the hospital. It's because of the area you find yourself. But we all are susceptible to getting malaria. But these people actually are more susceptible, especially the kids, the under 5 people, and those who are pregnant. And these people, when they get the malaria, it can really be that bad.
That is always when, in terms of pregnancy, you talk much about malaria.
Exactly. So that's why even when a woman comes and we suspect it's malaria, we have to make sure that this woman is not pregnant.
Can this mosquito net prevent getting malaria?
Exactly. There are lots of things that prevent malaria. So I don't know if I can talk about it
Let's
now.
move on.
So for now, since October 2021 now, malaria vaccine has been added to the immunization protocol in Ghana that we've started giving to the kids. So that one is not it doesn't prevent you totally from not getting it, but it decreases the incidence of malaria in the kids, and also decreased how severe it can be in the kids. Secondly, we can use the mosquito net, because the main thing starts when a mosquito bites you. When I have malaria, I cannot transmit it to you. You have malaria, you cannot transmit it to me. It's only when you are bitten by a mosquito. So now our primary prevention is to prevent the mosquito bite. And how do you prevent the mosquito bite? Anything that will send the mosquito far away from you. So one, the treated mosquito net prevents these mosquito bites. We have these insect repellents also prevent these bites. Clearing our gutters also, because that is where they habit. They actually stay. They like water areas, muddy areas, bushy. So if you actually clear your gutters, there's no stagnant water around. There are no pots containing stagnant water. You've cleared them, then that means that they don't have anywhere to stay. So then they will go far back. If you clear your bushes, they don't have anywhere to stay, and they go back.
Look, let's go back a little concerning can malaria cause brain tumor or brain something?
Okay, for malaria causing brain tumor, there is nothing that has been studied on. But malaria, we call something that we call cerebral malaria. Malaria can also affect the brain and cause some signs and symptoms. So that was what I was saying, that when a patient comes and the patient is having a seizure, and maybe she's seizures. Yeah. When I say seizures, that's what we call like a stroke. That's a seizure. encourages a common penny for say, yeah, say, winya cerebral. If you get the cerebral malaria, you can get the esro, can get the seizure.
Which country do you have some country? Because when we check sub-Saharan African, Southern Asia, some island, Central America, North, South America. This why do they get much of malaria? Because of the island, because of the area they are.
Exactly. So you realize that we are in the temperate zones. One, we are in the temperate zones, and the mosquito are actually mostly like the temperate areas. Secondly, we are found close to a lot of water bodies, so that also puts us at risk of getting the mosquitoes. The other countries that have been able to eradicate these malaria, but we are not there yet.
We are not there yet. We'll go for a break. When we come back, we'll talk about whether, since you work as a doctor, cases concerning malaria, how do you see Ghana? How do you see Central Region as well as Cape Coast? Because we are working at Cape Coast Teaching Hospital. The cases you are seeing through, whether we have some dangers or whatever we're supposed to do to prevent ourselves. So let's go for a break. Then when we come back, we'll continue our discussion. So we are back, and we thank you, the viewers, for always viewing our channel, that's MC Online TV, on the program Wosu Kebi. Today is World Malaria Day, and we thank God that we have a doctor from CCTH. CCTH is Cape Coast Teaching Hospital. She is Dr. Amma Owusuwa Kwachi, a beautiful doctor. And it's very important always when you attend to hospital, a history is very, very important as he has educators. So when you go to hospital, you should have a good history. Ebaka nukar, ebaka samu here, I'm a doctor and so be pokora as a bacono tomorrow. That is obi here, the dema abakwa sametum na catch on, I'm so tomorrow, kana butuma for that, or tum no was or yerba. A bit of so hospital with the dream of one pokora. That could feel do fear now at Apple. Soon be so you also hospital, made the hospital by my tapo, as Bacono, I am in a chong yimmy beam. The doctors and all whom is in our patients. You should, when you go to hospital, you should be patient. If Esiabuta, now doctor, you were to me a zoom como, which na aboa, and it's now clear. Yakwa question there. If you're a Ghana, if you're fin finamanto, if you go, can be a that's automoji chuma. Of February to Berino, malaria cases or tumaba. Or Shena, the means of making automobile, or on the house on Sipanina, to if you're Ghana, you were how Cassi, or your TD, Abraham, and there, or your malaria home. I should think for Mantoni, I should be out tomorrow, you and Dr. February. The main cases in a bit tumaba, and then brushing off or different diseases altogether. Was it be bacana some warrior fan to get us up? Me, I'll buy, you know. Me I buy malaria, me I buy malaria, me I buy TD. Into my minutes is wara, me a code out of me TD, Morana me TD, me a free homara me TD. Into Nina, that is what we hear there back up on the nursery. Na Yako, our cautious share, Sunday bet nephew. Doctor, welcome back.
Thank you.
Let's see Ghana as a whole. This malaria case is often seen in Ghana as well as Central Region where you are working.
So, thank you. So, we still see these malaria cases. Before I came to Cape Coast, all the hospitals that I've been to, we're seeing malaria cases, some very bad. I can remember a lot of the pediatric, they come very bad. I don't know whether the parents delay in bringing them. They come very bad. Some end up losing their lives because of how severe and how they've left the person to be in the house for a very long time. They come, you give them medication, they are not able to come up. So we still see Cape Coast here. Since last year, we've still been recording cases. We are still diagnosing malaria. And we realize that they are not using the insecticide mosquito net, the preventive methods that we've already been educating to them. We ask them where some of them have them bed nets, but they are using it for something else. Some of them, they said they are using it for their garden. Yeah. They are using it for their cocoa. A lot of explanation. Meanwhile, you are supposed to sleep under it, and that will protect you from getting the malaria.
So when you are passing, whether in a car, whether you are walking, you see all this, how do you feel as a doctor? People using the mosquito net or for all this, how do you feel?
It's not a pleasant sight to see, because these are things that are given for free.
Yeah.
The country, they've been able to procure this amount of bed nets so that it will help us. It's part of the eradication program that is going on, but the people are not sleeping under it. Someone will tell you that sleeping under the mosquito net is very hot. But it's not a pleasant sight though. But you talk to them, they come to the hospital, talk to them. Some of them change their mind and sleep under, but some too, no, they still use it for their own.
How do you feel if a patient came to the hospital, you try to maybe take care of him or her, and unfortunately this isn't happening? How do you feel in terms of especially the malaria cases?
It's very sad. We doctors, we are also humans. And when anybody passes, especially you devoted your time, you want to enter everywhere to make sure that your patient come up, then your patient dies. It is very disheartening. It is very, very, very sad. And especially when it is malaria, that we have drugs that maybe when they had come earlier, maybe we will be able to sort everything out. I won't say 100% that we can solve all these issues, but at least appreciable amount of percentage that comes, we are able to, when they come early, when you get the drugs, you'll be fine.
You made mention of getting the drugs. Malaria drugs are taken with time, hours. Why? And when they are given to you, they say you should eat before you took it. So why are these things happening in terms of medication?
So someone, for eating before medication, it's not only malaria drugs that we give. There are some drugs that can actually increase your metabolism. There are some drugs that can really make you very weak. These drugs, some of them can also make your blood sugar go down. So we encourage you to eat very well before you take it. And there are some people, they will just doubt us. They will just go and take it without eating. Then they come back with, I'm feeling dizzy and all those things. So for that one, when they give you time to time, and because the reason why we are giving it time, we call something half-life. So the half-life of a medication, that's why there are some drugs, we tell you that this drug, take it once daily. This drug, take it 3 times daily.
As I said, failing to follow the instruction you gave it to the medication, then they brought me back again. What do you feel it? Because you gave me that I should took this 3 times or 2 times, and I didn't, and they brought me back again, that the same issue, and you met me as a patient, as a doctor. How do you feel it?
Sometimes you'll be, in a first instance, you'll be angry a bit. In the second, you'll be thinking, why would you do that? You come to the hospital, we've given you a drug to take, you go, you take some and leave some, then the malaria is still persistent. My duty as a doctor is to take care of you. So whether you took my instruction or not, I still have an obligation to take care of you. So I'll just continue and I'll do the thing. But the whole thing comes to you having to suffer at the end of the day. Because if you had taken your drug, maybe you'll be in your house doing your work. But now you didn't take your drug. You have come back again. The time that you can use to stay in your house, work, get something for your family, now you are spending it at the hospital. And now we say time is money.
At this year, Malaria Day or subsequent ones, so far as we are working with some hospitals, we are teaching hospital, when it comes to the international days concerning this malaria issue and different, what do you do as a doctor? Do you have a special duty for the day, or you have a special program for the hospital, or the hospital have a special program in terms of international days of some diseases?
Yeah. Oh, so we just celebrated the World Kidney Days. There are some programs that they align towards these International Disease Day. It depends on which department. So but in all, we give awareness to the public about malaria. So during those times when you come to the hospital, before they start, they give a very brief talk about malaria at the general clinics to help inform the public also.
So this year, what are you going to do?
For this year, we will talk about it.
Yeah, because we will monitor and come to the hospital and say that you are doing something.
Sure,
even the education is very, very important.
Sure.
Even if you are doing education for your patients, we would like to visit. We would like to also to listen to you. So you're supposed to invite us.
Sure.
Yeah, you're supposed to invite us. Now this year, the WHO brought a theme that we should celebrate with. That 2024 health, quality, gender and human rights. As whether a patient has a community member as an opinion leader, when it comes to these days, as a religious leader, when it comes to these days, can I do something in my community to also support, and what type of project should I embark on?
So as a community leader, you can Organize some cleanup exercise in your area. So you can organize your people. We can all go clean our area. Wherever is bushy, we clear them. There are some gutters around. You make sure you tilt them. Keep the place clean. It also helps the propagation, because right now we are telling you, but you people actually doing it. And then you institute it. It's not supposed to be only for that day. It should be periodically.
Okay. We should not wait till the day
Wait till
before.
the day.
Okay.
We should do it periodically.
When you talk about WHO, you are not working there, but so far as you are a doctor, you may read the meaning of their things. Why are they celebrating these days? It also brought something to the human nature or our lives concerning celebrating all these days.
Okay, so the World Health Organization, so it's an organization for the whole world.
All right.
So we are actually celebrating these things. At least these are the days that even if there's nothing that you talk about, at least we know that we will create awareness with this particular disease.
Okay.
Because these diseases are the diseases that are killing us.
Okay.
And we need to actually eradicate them. And so this time gives us the opportunity to actually educate the public, even though we've been doing it, but at least we take one day and we celebrate the disease and actually educate the public about it.
Okay. Now, what is your general advice to the public?
So my general advice is malaria has not left us. We are still living with the malaria. So first, the primary prevention is very important. We should always try to prevent ourselves from getting the mosquito biting us. If we know that maybe our surroundings are dirty, gutters, we should clear all these places. We should try as much as possible to sleep under the mosquito net. I know this time the weather is very hot, but it is better to protect yourself than getting the disease. And also, if we can get the repellent, our younger brothers who are in the secondary school, we should get them the repellent and also the mosquito net, and protect ourselves in general. And whenever we are having any of these symptoms, we shouldn't self-medicate. We should get to the health sector and you will be given the appropriate treatment.
Right. That's the end of the show. We thank Dr. Amma Owusua Kwachi. We thank her very much from CCTH, Cape Coast Teaching Hospital. She has helped us deliberate more, educate the public more concerning malaria, because today is World Malaria Day, and we thank her very, very, very much. Yeah, Mom, yes, son, so then. Yeah, Yimpay, you are Brabham, Doctor C, or be here, there, say, Yin, Yarba Biara, Ebomaji, Tanamaria, or Yapamzana, sorry. Na yedi wa kachire in doctor habon komo doctor se debia wo homen ahinti na wo ho nti se wamba na chere hodwuma na me so nti ayare ofie bomazan bra man kade koto edu na efi wangasa etum na anu na aye itayi no medru ofie de pi bo na yare ba na okono wasa na chere aba nti yema mazi na fie ntum na yenko oya pomzina so na yenko na wuzo edru ma hine so a yennum wo ye na mbredo ana obutum na wabo hin ankasa yentan sisi oya hin fuchir ahoro biara awde etumi sisi bibi so atata biara mo mazene ye be clear ho hinara bibi ho efu bo mazene ye tumi ya clear ho hina ye beda oye insecticide treated net mosquito net wo tumi na wa ahye na edu ye mosquito net wo tumi na efu ogu bibi akwakafa doctor na you want time jo ho do ababande mosquito net ebinim wan tona mahin oza chen na babande akaji no fofor na le senem na fi ada ya garden ele senem na fi ada hanta okoko abande ma onye penye because we disika na otum do to da mezamene na na order for you me hen oye plane otum do ba oye amana ho piedo na so bin wa ho na dwe na anu na odubudua oye ho duaba o se da musu na bani ya mama ze na fi ntum sesa otum na wa aboa hin amahon yin waje so afebre to be otum na waje dibiare hia se gana yin ntuma na amana foforo wotu na wana azana wa abaka na eba na da aka genet edue wa hwe na da adwo edue buru na da adwo aba na ma na wa mbwa waso ala boma ni bi dem atene mo nsa wo bi no dun and nana wa kan bi so no so baaze na etumari nti ma baze yen hye ne so. My name is still Omar bin Abdullah, and we thank you. Have a nice day.